putting more pressure on epidemic prevention and control. So we must stay vigilant against this virus, and we must respond swiftly with the most stringent measures and actions to guarantee the safety of Beijing and the safety of our locals. Our epidemic prevention and control must be quick. We must locate the close contacts of the confirmed cases instantly, and also immediately. We must also close down the places, neighborhoods of the confirmed cases, and also immediately for the buildings or public places where the confirmed cases once visited, we must conduct the nucleic acid testing. For the visitors coming in and out of Beijing, if they are the close contacts, they must report their health status immediately. In addition to those people themselves, their family members, their employers, colleagues, and neighbors must also be managed in a closed loop with no likelihood of gathering. And for the people coming in Beijing, they must also report to their entity and their committee about their status. If they have any fever, cough, fatigue, and other suspicious symptoms, they must wear facial masks and come to the closest fever clinic immediately. And they must not handle their symptoms by themselves, for example, by administering drugs, and please adhere to the certain requirements of prevention and control of epidemic. Stop gathering with a large population. Wash your hands frequently, keep good ventilation, and keep a social distance. In addition, for the vaccinated population, please be reminded that it's not the safety box. You still need to have self-protection while getting vaccination. Observing strictly the certain joint prevention and control mechanism concerning Beijing and the visitors coming in and out of Beijing. Unless necessary, stay in Beijing. Unless necessary, do not go abroad. You must all hold yourself accountable in terms of the epidemic prevention and control in order to safeguard our homeland. Today, we have invited the Haidian district government leaders and officials from the CDC branches. Now, please allow me to present to you our leaders. From Haidian District, Deputy Chief Lin Hang. From the CDC of Beijing branch, Vice Director Pang Xinhuo. Now let's give the floor to Madam Pang Xinhuo to brief us the updates of the epidemic in Beijing. Dear media friends, now I would love to give you the newly added confirmed case. The number is 1, and it's related to the recent outbreak of epidemic. On August the 2nd, there is one more confirmed case in Beijing. This case is a close contact of the confirmed case on July the 29th, residing in Haidian District, number 20, Guoxing Jiayuan. On August the 25th, he commuted from Changsha South Railway Station through the train of J486 and arrived in Beijing West train station, and upon arrival, he drove to Haidian District. On July the 29th, he voluntarily reported his case to the neighborhood and required the quarantine. The first test result was negative, but he got the symptoms like cough since July the 30th and got fever on the 31st. On August the 1st, another round of nucleic acid testing showed positive, so he was transferred to the designated hospital. Considering epidemiology and clinical symptoms, the lab tests, and other imaging techniques, on August the 2nd, he was confirmed as a positive case, and the type of his case was normal COVID-19 case, and he has introduced some prevention and control measures in line with the epidemiology investigation. And initially, we identify the close contacts of that confirmed case. There are 9 of them, and certain prevention and control measures are already in place. We are still checking the other possible close contacts. As to the family members living together with the confirmed case, we learned that as long as there is any other confirmed case riding on the same train as this confirmed case, they must report immediately and be isolated. Such a measure will guarantee that the CDC staff members can take in relevant prevention and control measures. And all of the family members living together with him have all observed the certain requirements. We have to give the alert again that if you have ever paid visit to Zhangjiajie, Zhengzhou, Nanjing, or any other highly risky cities and come back to Beijing recently, or if you have got the knowledge of being a close contact of the confirmed case, please report voluntarily to your neighborhood or your employer. Now, the global pandemic is still plaguing, and domestically we've seen the outbreak in many places, and Beijing has witnessed many related cases with this new round of epidemic. So we are still at a critical stage of epidemic prevention and control, and we cannot let go of any potential risk. We must hold the certain parties accountable 100% to prevent imported cases or the transmission of domestic cases, and voluntarily report your traveling history to your employer or your neighborhood. Get nucleic acid testing and be isolated if you are a suspect. And for the catering business, sanitation, cold chain, or the household management businesses, those staff members must strictly observe the requirements of vaccination, nucleic acid testing, wearing facial masks, and other personal protection measures. For the isolated personnel, all the stay-at-home personnel, they must also be observant during their observation period. Any abnormality physically must be reported and must be hospitalized according to the requirement. So please protect yourself and wear facial masks. Wash your hands frequently. Keep good ventilation and keep a social distance. If you get fever, cough, and other symptoms, wear your facial mask and go to the closest clinic for hospitalization. And please report your living situation and your traveling history to the certain medics. So those are all the reminders I have for you. Thank you, Madam Pang Xinhuo from the CDC Beijing branch. Now let's invite Deputy Chief of Haidian District, Lin Hang, to brief us about the prevention and control situation in Haidian District. Good afternoon, dear media friends. Now please allow me to give you the newest information about the epidemic situation in Haidian District. On August the 2nd, one isolated person was confirmed. So immediately our district gathered together our on-site guiding team for certain settlement of that case. Now, I would love to present you the details of our work. Firstly, we quickly isolate the close contacts. The confirmed case you heard just now have 5 family members living together, and on July the 29th, those people were managed together as the close contacts, and on August the 2nd, they were already transferred to the designated isolation site, and their samples were taken. The nucleic acid testing results were all negative. For all the other 4 close contacts, they were also transferred. In Guoxing Jiayuan neighborhood, number 6 building has been home to a lot of people, and those people have all been designated as close contacts. And since July the 26th, for all of those visitors to Guoxing Jiayuan neighborhood, they were also investigated. Secondly, we quickly closed down Guoxing Jiayuan neighborhood and the surrounding entities and neighborhoods. On August The second, we have evaluated the risk level of Guoxinjiayuan and the surrounding neighborhoods. The first part starts from Zhegongzhuang Western Road till the Capital Stadium South Road and Sanlihe Road. The total area is around 230,000 square meters. The second part is the Planning Institute of China, covering about 10,000 people. In the risky areas, all of those entities were closed down, and all of the people cannot get out. Thirdly, we immediately kick off the all-mass nucleic acid testing. Our district has get in place the certain medics in the risky places. We come to each entity and each building for nucleic acid testing. Now, 4,500 samples were taken. We are still waiting the results. Fourthly, the management of the surroundings. The surrounding entities must also employ the mechanisms of the cold checking and temperature taking. And in the public places, the population flow must be kept at below 50%. And for the working places, the rate must also be 50% on post. And also in the risky places, they cannot go out of Beijing. If they do, they must have the health code and the negative test results within 48 hours. Fifthly, service guarantee in the risky areas. We are also guaranteeing the service level by setting up the service teams to serve those neighborhoods. In the supermarkets, we arrange 40 people to deliver the necessities. In Guoxinjiayuan neighborhood, 80 people were arranged to deliver the goods to their doorsteps. We also designate the medics, public security, amounting to 500 people to be part of this neighborhood and community management. And they are responsible for sanitation, disinfection, and so on. We also mobilize different forces to participate in service guarantee in the risky area. We also offer the prevention materials and life necessities. For those local people living there, we also offer some mental help. In the next step, Haidian District will detailize the epidemiology investigation and highlight the screening of people coming in and out of Haidian District. We will also handle the nucleic acid testing of certain relevant people, and we aim to block the channel of epidemic transmission to guarantee the district safety. Here, I would also love to give our thanks to the locals and entities residing in this risky place. Thank you for your support. Our management measures will certainly have some inconveniences, but we will step up our services. Also, for those people who once visited Guoxinjiayuan neighborhood since July the 26th, please voluntarily report your traveling history to the certain entity. Let's work together to win the victory of this battle against the COVID-19. Thank you, Madam Lin Hang, for your report. I also would love to thank our media friends and all the staff members. This is the end of today's presser.